Like and subscribe for daily OT brain boosters. Occupational therapist is working with a client who sustained a C6 spinal cord injury. The client is completing a feeding task using adaptive equipment and is able to finish the meal with mild fatigue. Therapist wants to grade the activity to improve upper extremity endurance and postural control while keeping the task safe and functional. Which intervention is most appropriate? B. Place food items slightly farther across the table to encourage more reaching. Context: this grades the activity up by increasing controlled reaching, which helps build endurance and upper extremity control without removing the client's active participation. OTR is developing a patient intervention comparison outcome (PICO) question to search for evidence related to improving handwriting skills in children with autism spectrum disorder. Which action will best help the OTR develop the P component of the clinical question? D. Identify the diagnosis, age group, and functional problem of the client. Context: P in PICO stands for population patient problem, so the therapist needs to define who the patient is and what problem they have. OTR on an early intervention team is working with a 33-month-old child who has developmental delays in communication self-care skills. Child will transition to a public preschool program in 3 months. Parents are worried that the child will have difficulty adjusting to the new classroom routines and expectations. Which action should the OTR take first to support transition to preschool? B. Collaborate with the family and preschool team to share information about the child's strengths, needs, and supports. Context: the best first step in transition planning is coordination and collaboration. OTR asks a client with Korsakoff syndrome about yesterday's therapy session. Client gives a confident but incorrect description of events that never happened. Which behavior is the client demonstrating? A. Confabulation. Like, comment, and share. Learned something or nailed it? Follow us to stay OT sharp. You got this.